2023 NEHEP Partnership Summit, Healthy People 2030 Presentation, March 17, 2023, Bethesda, Maryland. Slide, Office of Disease Prevention and Health Promotion, ODPHP, Speaker and Q&A.
It's my pleasure now to introduce our second guest speaker. Emmeline Ochiai joins us from the Office of Disease Prevention and Health Promotion, or ODPHP. Emmeline is going to chat with us about Healthy People 2030 vision objectives, which we'll also talk about in our discussion circles. After her presentation, you all will have the opportunity to ask her your questions. Emily is a senior advisor at ODPHP under the Assistant Secretary of Health at the U.S. Department of Health and Human Services, or HHS. During her tenure there, she has had a leading role in the Secretary's Advisory Committee on National Health Promotion and Disease Prevention Objectives for 2030, leading efforts to address the social determinants of health and health equity. In 2021, the White House recruited Emmeline to serve as a special advisor to the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders. She is a graduate of Harvard University and Bryn Mawr College. Please join me in welcoming Emmeline.
Good afternoon, everybody. It's wonderful to see everybody's happy faces. I hope you're full and feeling good about today's events. I really enjoyed doing the speed dating this morning. I'm going to tell my husband I was doing that, and we'll see what he says. I'm Emmeline Ochiai. I am a middle-aged Asian woman with black hair and reading glasses. It is an honor for me to be here today. I want to share that in the early part of my federal career, I was actually an ODPHP liaison to the vision objectives.
Slide, Healthy People 2030's National Vision Objectives and Champions.
And I have had the pleasure of presenting to NEHEP back in the 2000s. As a result of that, the vision objectives and NEHEP have always been very special to me. I'm joined today here with one of my close colleagues, Asel Ruskova, who is standing in the back, or she's standing in the back. I'd like to acknowledge her because she is instrumental to tracking the vision objectives and Healthy People 2030 and 2010 and 2020. So she has been really a key expert in terms of making sure that we're making progress towards the vision goals for the nation. I'd also like to thank the NEI and NIH staff for bringing us all here today. And most importantly, I want to thank each of you. We need to work together in order to achieve the most challenging problems that our nation is facing, particularly with regard to vision health. And working together, I'm confident that we will be able to make great strides. So before we get started, just by a show of hands, could you all tell me if you're familiar with Healthy People 2030? Okay, good. Okay, so several of you are familiar with Healthy People.
Slide, Agenda.
So let me just share what we were going to go over today. I'd like to share with you an overview of the Healthy People 2030 initiative and its vision objectives. We have some new enhancements that you may not be aware of that will be useful to you out with the communities that you work with. I'd like to share a little bit of an assessment of where we are with the nation's vision health and the 14 objectives that are in Healthy People that are vision related. We will discuss the ability for you and others to use Healthy People as a tool for action. And we have launched a new Healthy People initiative called the Healthy People 2030 Champions. I know that several of you here are already champions in your communities, and we would love to encourage you to apply to be a Healthy People 2030 champion to be recognized.
Slide, What is Healthy People 2030? Provides a strategic framework for a national prevention agenda that communicates a vision for improving health and achieving health equity, identifies science-based, measurable objectives with targets to be achieved by the end of the decade, requires tracking of data-driven outcomes to monitor progress and to motivate, guide, and focus action, offers model for international, state, and local program planning, represents collective input from interested users from across the federal, state, local levels, tribes and territories, and public and private sectors.
So what is Healthy People? Healthy people is what I would call the federal government's SMART goals. They're specific, measurable, achievable, realistic, for the most part, and also time limited. One of the great things about Healthy People is that it has withstood the administrations of both political sides for 4 decades and is now in its 5th iteration. It was launched in 1980, and at the time, Julius Richmond, the Surgeon General at the time, he was very interested in finding out where we are as a nation in terms of health status in order to determine how we can make improvements. The focus was really on morbidity and mortality, and across the decades, it has moved further and further upstream to now include a very significant focus on social determinants of health, and it's all because of the science and evidence that we have available to us.
Slide. Healthy People 2030 Framework.
So the Healthy People 2030 framework has been developed with public comment and subject matter expertise input. Here on this slide, you can view the vision of Healthy People, specifically a society in which all people can achieve their full potential for health and well-being across the lifespan. We have a specific mission and specific overarching goals.
Mission: to promote, strengthen, and evaluate the nation's efforts to improve health and well-being of all people.
You'll notice here that well-being is prominently referenced. That is one new component of Healthy People 2030.
Overarching goals: attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death. Eliminate health disparities, achieve health equity, and attain health literacy to improve health and well-being of all. Create social, physical, and economic environments that promote attaining full potential for health and well-being for all. Promote healthy development, healthy behaviors, and well-being across all life stages. Engage leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being of all.
We really do want to promote a whole person well-being. And one of the things that that you all can look forward to in the next coming months is the department's first measure of well-being, measured as a self-assessment of life satisfaction.
Slide. Healthy People 2030 Objectives and Measures.
On this slide, number 6, you can see that there's a relationship between several elements. There are the Healthy People objectives, the leading health indicators, and the overall health and well-being measures. The graphic shows a relationship between these elements. Essentially, what's happening is that if you're moving from the bottom up, the core objectives, which are measurable objectives for which we have data and targets.
Leading health indicators, a small subset of 23 high-priority Healthy People 2030 core objectives selected to drive action towards improving health and well-being.
And the developmental objectives, for which we do not have data, but we are trying and striving to collect data for, and the research objectives are all feeding towards overall health and well-being, towards the vision of a society in which all people can achieve their full potential.
Slide. History, Healthy People Vision Objectives.
So the vision objectives in Healthy People have a storied timeline. What's really interesting about the vision objectives is that NEI wrote the chapter in 1998 for the first time. And the chapter resulted in a launch of several objectives that have now become measurable.
1998, Vision Community submitted the vision objectives during HP 2010 final comment period. 1999, 13 vision objectives were approved. 2000, Vision and Hearing Focus Area of Healthy People 2010 was launched. 2004, all objectives became measurable. 2010, Vision Topic Area was included in Healthy People 2020.
And we now have a total of 14 vision objectives that were launched as part of Healthy People 2030. I do want to tell you that a significant amount of work was done in order to make these objectives measurable.
Slide. Healthy People 2030 Vision Objectives. Status of measurable objectives as of February 10th, 2023. Status. Baseline only. 8 vision objectives. Increase the proportion of children aged 3 to 5 years who get vision screening, VO1. Increase the proportion of adults who have had a comprehensive eye exam in the last 2 years, VO2. Reduce vision loss from diabetic retinopathy, VO4. Reduce vision loss from glaucoma, VO5. Reduce vision loss from cataract, VO6. Reduce vision loss from age-related macular degeneration, VO7. Increase the use of vision rehab services by people with vision loss, VO8. Increase the use of assistive and adaptive devices by people with vision loss, VO9. Status, little or no detectable change. One vision objective. Reduce vision loss in children and adolescents, VO3.
The data to collect the objectives is not a small feat. We need to use federal data sources that are both nationally representative but also reliable. And NEI took the path of choosing the gold standard in federal data sources, the National Health Interview Survey. Each of the questions costs about $170,000 to field, from cognitive testing to fielding it out in the community and then analyzing that information. And most recently, they've spent over $3 million to ensure that there's current data that's coming forth. So they didn't waste any time in terms of making sure that there was available for folks. And so you might actually be wondering, all right, well, how are we doing with the objectives right now? And on the slide here, you can see that we have 14 vision objectives. 9 of them are measurable with targets, meaning that they have a baseline and are moving, we're tracking them, we're able to track them. There are 2 developmental objectives associated with evidence-based interventions, but for which we don't have reliable baseline data yet. And then there are 3 research objectives for which we don't have any evidence-based interventions. So NEI has worked with the National Center for Health Statistics to fund the vision supplements for NHIS, both in several years, 2002, 2008, 2016, 2017, and efforts are already underway to collect the next NHIS vision supplement with the idea that we anticipate data to be coming in 2025.
Slide. Highlights of core objectives.
If you go to the Healthy People website, you will find a number of user-centered interactive tools, including the vision objectives, and you can actually see different components. Here is one of the vision objectives: increase the proportion of adults who have a comprehensive eye exam in the past 2 years. There is an objective status, so you can see like whether or not we have a baseline, if we're making progress towards the target. There's also population level data. If you clicked on the solid blue button that's available, or on the button that says see detailed data for the objective, you can actually graph or chart the data by population, education, and other demographic data for anything that we have available. And then you can also find the baseline year.
Slide. Increase the proportion of adults who have had a comprehensive eye exam in the last 2 years, VO2.
Let's take a look at some of the ways that we can see the data in more granular detail. So here's an objective: increase the proportion of adults who've had a comprehensive eye exam in the past 2 years. This is vision objective number 2. You'll see here that we have graphed this against education. On the x-axis, you can see the number of adults age 18 and over with diabetes that had a visual impairment due to, oops, sorry, I'm on the wrong page. On the x-axis, you can see the number of adults receiving a dilated eye exam in the past 2 years, and on the y-axis, you will see the percent. So you can notice here in this particular educational attainment lens that the more education one has, the higher percent of individuals who've had a comprehensive eye exam. So there's a direct correlation between the 2.
Slide. Reduce vision loss from diabetic retinopathy, VO4.
This is the objective for reducing vision loss from diabetic retinopathy, and we have paired this with the relationship for family income. On this slide, you'll see on the x-axis the number of adults age 18 years and older with diabetes that have a visual impairment due to diabetic retinopathy. The x-axis has the family income in relation to the poverty threshold. So here, the total number of adults is 33 per 1,000 age 18 years and over with diabetes who've had a visual impairment due to retinopathy in 2017. Below the poverty threshold, you'll see that there are 57 adults per 1,000, and at or above the poverty threshold, you'll see it's 46.9 per 1,000. Two to three times above the poverty threshold, it's 33 per 1,000 adults. And so as we see here, family income is inversely correlated to vision loss from diabetic retinopathy. And I see that there are some people who are taking photos of the slides. These slides will be available to you. And if there's anybody here who would like to see a live tutorial of the site at some point during today, I'm happy to walk people through that as well. So moving on to the next objective that I'd like to call your attention to.
Slide. Reduce vision loss from glaucoma, VO5.
One of the things that we're able to do also in the slide charting is that we're able to see how race and ethnicity relate to specific objectives in the vision objectives. Particularly in this one, there's vision loss from glaucoma, vision objective number 5. And you will see here that on the x-axis, we have each of the populations, and on the y-axis is the number of number per 1,000 adults aged 45 and older with a visual impairment due to glaucoma. The total number is 13.2 per 1,000 adults aged 45 years and over who had a visual impairment due to glaucoma in 2017. The Hispanic or Latino population had 15.2 per 1,000. Asian only, not Hispanic or Latino, had 17.9 per 1,000. Black or African American only, not Hispanic, had 21.6 per 1,000. And white only, not Hispanic or Latino, had 10.9 per 1,000. The best group was 2 or more races, not Hispanic, with 7.3 per 1,000. So one of the things that's really useful about Healthy People, and particularly these graphing features, is it allows us to see significant disparities in areas where we need to target populations who are at higher risk or have higher prevalence.
Slide. Healthy People 2030 Insights, Tools and Resources.
And with Healthy People 2030, we have gone to a much more interactive suite of tools that individuals can access free of charge anytime that you might be inspired. So we have not only reliable national data for disease prevention, health promotion objectives, we have specific population data that reveal health disparities. We have the data charting features, which are developed in real time based on what's available in the system. You have a target setting tool that if you're interested in setting targets for your particular communities, those tools are available to you, and we do provide technical assistance to organizations who become Healthy People Champions, something I will speak to you about shortly. We do have specific evidence-based resources that we link to every topic, including the vision topic, and where it's appropriate, we actually link those evidence-based resources to specific vision objectives. These evidence-based resources are rigorously tested interventions that we encourage people to utilize in order to drive progress in their communities. And one of the things that's new also to Healthy People 2030 is an updated list of social determinants of health literature summaries. Many of you have heard about social determinants of health in the news these days and how it is affecting health outcomes, but there are a number of people who have reached out to us to express that having the research available to them to show to policymakers about the relationship of specific determinants of health to health outcomes has been short in supply. So we created these literature summaries to allow you to bring the literature with you or to inform policymakers as you do your work. So for example, having an adult social community context is a social determinant of health. There are literature summaries available to show that voting is a social determinant of health. And we have a new voter objective that's being added to Healthy People as well as a social determinant of health driver. We also are featuring Healthy People in Action. So organizations who are doing great work, we want to amplify We want to amplify their activity so that others are aware of both of the activity and also any innovations that might be taking place. So we feature those individuals in the Healthy People in Action series. And if you're a champion, there is a very high likelihood that we will feature you in that as well. And then if you're interested in learning about ongoing evolving science and how we're doing with the nation's health, we have free quarterly webinars that I would encourage you to sign up for on the Healthy People website.
Slide, leveraging healthy people to advance health equity.
So you may be wondering, how do people use Healthy People to actually address health equity? Well, one of the ways is that what I've showed you earlier is that you can actually identify specific disparities by population group, whether it's by race, ethnicity, education. We have geography. Disability status is also available for some of the objectives. People use the data to drive state health improvement program planning. We have had several organizations come to us who've received CDC SDOH accelerator grants, and they're using Healthy People to identify the ways that there are equity issues in the nation to help hone in on the equity issues in their local communities.
Slide, ways organizations use Healthy People. Examples.
And then there are different ways that people can use Healthy People generally. So you can align with the framework. I know that sometimes there's so many health issues to address, and perhaps you're not sure where to start with particular vision issues. I would encourage you to start with the 14 vision objectives in Healthy People. If you are planning something, perhaps benchmark to those objectives, knowing that there are other groups around the country who are doing the same. Perhaps work with other groups who are interested in similar issues to create coalitions, which is something that we've also seen a great deal of success with.
Align with the Healthy People framework. Health improvement strategies may include broader social factors that contribute to public health issues, for example, transportation and economic development. Compare local data to Healthy People data. Example, the Indicators-Based Information System for Public Health, IBIS-PH, is a dashboard that allows states to track data and compare to Healthy People objectives. Slide, Healthy People 2030 Champions.
So as I mentioned earlier, we have a new Healthy People Champions initiative.
Slide, what are HP 2030 Champions?
This champion initiative recognizes organizations who have a demonstrated work towards the Healthy People vision, mission, vision, overarching goals, and even specific objectives. So they hail from a variety of sectors.
Slide, who are the Healthy People 2030 Champions? Health data and technology organizations, coalitions, advocacy groups, government agencies, nonprofit community-based organizations, healthcare providers, educational institutions, research organizations, membership organizations/associations.
Knowing that one of our overarching goals is to engage multi-sectoral partnerships, we have leveraged this partnership arrangement to not only recognize organizations who are champions with a badge and then to amplify their work, but also to help them connect with one another, network, and leverage one another's resources and skill sets.
Slide, what does it mean to be an HP 2030 champion?
What does it mean to be a Healthy People Champion? So when you become a Healthy People Champion organization, one of the things that's great is that you are brought into the fold with other organizations who are working towards similar goals. We do provide you with a badge and press release that you can announce to your networks.
Timely information and update on important Healthy People activities.
We link to you on social media. We also provide learning collaboratives on a quarterly basis that involve technical assistance. We have quarterly office hours, so if you wanted to have technical assistance one-on-one with individuals from our office or from potentially NEI, or meet with a cell about specific issues around data collection, we are there to meet with you and help in any way we can. Additionally, we like to learn about what people are doing so that we can help to drive progress in ways there currently are gaps.
Neither HHS nor ODPHP will provide funds to support HP 2030 champions. Applicants and HP 2030 champions will not be expected to contribute funds. Slide. Eligibility and online application. Any organization may apply to be an HP 2030 champion, including but not limited to public and private organizations, governmental organizations, nonprofits, businesses, academic organizations, philanthropic organizations. Individuals are not eligible to be HP 2030 champions. Apply online, health.gov/healthypeople/about/healthy-people/champion-program/application.
In order to apply to be a champion, you just have to go to the website, and the website has a free online application, and they are reviewed on a rolling basis.
Slide. Selection and notification.
We currently have 160 champions that we work with. And as I mentioned, there are not only learning collaboratives.
Slide. HP2030 Learning Collaborative Activities. Anticipated activities include quarterly learning collaborative events led by ODPHP, resource sharing platform for champions, quarterly office hours with the ODPHP team and HHS subject matter experts, potential for champions to be highlighted in blogs, infographics, webinars, and conference presentations.
But there's also a SharePoint where you can share resources with one another.
Slide. Thank you. Healthypeople.gov, Twitter, @healthgov.
Thank you so much. So I'm going to turn the mic over to Julia, who's going to give us some guidance about question and answers today.
But she's not going to go far because now is our chance to ask her a question. So raise your hand if you'd like to ask a question, and a microphone will be brought to you. And I have a couple in stock to get it started while you're deciding about what questions you have. But I wondered if you could tell us a little bit about how the topics were determined.
Yeah, that's a great question. So Healthy People is really based on science and then also publicly driven. So we work with the subject matter experts within HHS and across the federal government because we actually harmonize our work with federal agencies. And they propose topics and objectives. Those are rigorously reviewed internally, and then we put them out for public comment. So every component of Healthy People has gone out for public comment. We really do encourage all organizations and individuals to participate in that public comment period. And I can assure you that every comment that we receive is evaluated. So they're all evaluated for merit, and we have added things and eliminated things based on public comment. We still do an ongoing public comment period annually. So each fall, there's a public comment period for new objectives or objectives that are moving from developmental to measurable. So if you have an objective that you think should be proposed, I encourage you to participate in the public comment period.
Could you tell us a little bit about the data, like how you get the data and where that comes from?
So we use hundreds of data sources to support the Healthy People objectives. The vision objectives in particular, as I mentioned, do get to use the gold standard in health data systems and the National Health Interview Survey. They are collected via a supplement on the National Health Interview Survey. So as you can imagine, each of us only has a limited attention span. NHIS will actually create, they have a core set of objectives they always ask, and then they have a supplemental section. And NEI has been paying to place questions to collect data in the supplemental section for several years over the past decade.
So people are answering it about themselves?
Yes, that's correct. I know you guys have questions. I talked to several of you in speed dating, so don't make me call you out.
Janet in the back.
Hi, I'm Janet Leisher from Nova Southeastern University, and I teach. I felt like I was sitting in my own classroom listening to my own lecture because I teach this to the students every year in our optometry program in Florida. I guess I have a question also about what may be going on with this data outside the U.S. We know that the UN just passed a resolution about effective cataract surgical coverage in every country around the world. And so, of course, luckily we have Healthy People 2030 that we're gathering data about visual impairment due to cataract. But then we took off refractive error from the Healthy People 2020 to 2030. And I was wondering why that was if we don't have that data. So just wondering about data manipulation and how that ties into broader resolutions and initiatives globally.
Yep, no, these are great questions. First of all, I'm delighted to hear that you teach it. One of the biggest joys for the staff is knowing that Healthy People is being taught to the next generation, succession planning, right? So the answer to your question is that many countries actually use Healthy People as a model for developing their own plan. We have Healthy Japan, we actually have Healthy China, we have Healthy Brazil, Healthy People Brazil. We actually have consulted with Russia, but they can't officially say that they use it. We've had the pleasure of working with Australia as well, and then we have a Healthy Korea. We even have a Healthy Egypt. So it is broadly used by other countries. Additionally, Healthy People is the US's contribution to the Sustainable Development Goals. So that's good to know. The absence of a particular health topic from Healthy People does not mean that it's not important. But we need to focus federal efforts, and we try to focus outside collective efforts on what we consider to be the most important ways to drive health improvement and well-being. So it was a very difficult decision, but with Healthy People 2020, we had over 1,000 objectives, and people felt spread way too thin. So there was a very specific, intentional move to reduce the number of objectives so that we could focus not only activity, but drive progress. And the idea is that, again, if we make progress on all of the 300 objectives that we have in Healthy People, that we will drive progress towards the overall health and well-being measures and drive our progress towards the vision. Yes, Asel, you have a question. You want to share something?
Want to talk about refractive errors. This objective was not removed. It was moved from co-objectives to developmental because we don't have data. The data for Healthy People 2020 objective was collected by National Health Nutrition Examination Survey, and it was also funded and supported by National Eye Institute. So in order to collect the data, we need to put all this equipment in our mobile examination centers and also train technicians how to do eye exam and how to make retinal images. And of course, it requires funding, money, and personnel. So we didn't do it since 2008, so there was no more recent data, so we had to put this objective on hold. But as I know, there are some plans, and CDC and NEI are working together trying to bring back the vision component to National Health Nutrition Examination Survey, sort of like to add eye exam to one of the enhanced cycles. So we're trying, but again, it requires extensive funding and resources.
Thank you, Asel.
Hi there. I know I chatted with you.
I know, it was great to see you.
So actually,
Just a reminder to say your name and
sorry,
affiliation.
Pramila Banwaite. And kind of an extension to Dr. Leisher's question around refractive error, and then also your point about eye exams. I'm wondering, would it be possible, I know it takes a lot of funding, extra effort, but what about simple vision screenings? Like for instance, for children, you have that as one of the objectives from 3 to 5-year-olds to increase vision screenings. Like, could it be that vision screenings are conducted as part of this to kind of understand what that breakdown is as well, like the health disparities and whatnot?
So are you suggesting that it be part of the data collection process?
Yeah. Mm-hmm.
I don't know, Estelle, do you want to address that?
Question asks like parents if the child was screened. And this is like a general question. So it includes both vision screening at schools, by like school nurses, and also like at any eye health professional like place. So it's just a general one. Because it's self-reported, and parents report it, we cannot specify. It's like a general one. So it's just asked if like the vision was screened. That's it.
I just had a quick question. Wade Delk with iJacapo. About the life satisfaction level. What are the indicators in that? Can you talk a little bit more about that and when that's going to be released?
Yeah, that's a great question. So when we have been trying to assess well-being as a measure of self-assessed life satisfaction for several decades, and getting that into the National Health Interview Survey required a significant amount of effort. When we were moving into COVID, it became very clear that life satisfaction and well-being were going to be very important. The OECD countries use Cantrell's ladder, which is it's a multi-part question that can be very complicated, but it was something that OECD uses, the OECD countries. And then we have Health Canada, which is closer to us, and they use a 4-point question, which is less complicated. So we actually fielded both questions in 2021 on the National Health Interview Survey to test them, and we found that as a result of cognitive testing, that the best question was the 4-point question, which is, all things considered, how would you define your life right now? Is your life satisfaction good, very good, not good, and poor? So essentially, we went with the 4-point question because that was the question that people understood the most. So that is the one for which we have the first round of data coming. I can preview for you that there is a significant disparity between the total population and the population people with disabilities.
Well, thank you so much for that wonderful comments and this amazing work to help our country continue to move forward.
We couldn't do any of it without all of you.
National Eye Institute, NIH, National Eye Health Education Program, www.nei.nih.gov/NEHEP.